checks for the Utah Department of Health and Human Services. Thank you all for being here today. At the core of our work is a commitment to the health and safety of people being served. And I, like every one of you here, was devastated when I learned about the senseless death of these three men. And like all of you, I realized that what I was feeling was just an nth of what the friends, families, and loved ones of these men were feeling. My heart goes out to all of them as they are navigating this unimaginable loss. I want to start today with some information on our Office of Licensing and what our role is in ensuring the health and safety of those in regulated programs. It is our job to make sure programs comply with administrative rules and regulations designed to provide healthy and safe environments for those in care. These rules and regulations are fundamental safeguards to protect vulnerable people being served in facilities and programs. We act within and only within the scope of authority given to us in state law. When a regulated provider is not in compliance with state rule or code, we have the authority to take several actions. Those include issuing fines, putting additional conditions on a provider's license, or revoking a license entirely. On February 6th, the Department of Health and Human Services issued a notice of emergency agency action the same day we learned of the deaths of three people being served by a licensed day program. This stopped the program from accepting new clients while we conducted an investigation. Our investigation uncovered multiple serious noncompliances with state rule, including, but not limited to, not providing supervision commensurate with the behaviors and needs of each client, and not protecting three clients from abuse, harm, mistreatment, or any action that may compromise the health and safety of clients. Based on these severe noncompliances, the Department of Health and Human Services is revoking the day treatment license of Safe and Sound Services. What this means is that they cannot accept any new clients. All services for existing clients must cease by March 31st, 2026, and the owners may not reapply for a new license for 5 years. Between now and March 31st, we will continue to prioritize making sure this program is safely serving its existing clients. We continue to conduct weekly inspections and monitor for rule compliance. If we identify areas of concern during these inspections, we will return as often as necessary to make sure that people are safe. And we will verify that the program is no longer serving people as of March 31st. Again, I want to thank you all for being here, and I have just a few minutes for questions.
What would you tell the families who are hearing about these violations for the first time? This is the first time.
I would tell them, one, I am so sorry because trauma for one of us is a trauma for all of us, particularly those being served by this system. And two, I would urge you, go to the department's website, to the Division of Licensing and Background Checks, go and look at the licensing record of your provider, anyone you're thinking of serving your loved ones. And if you have any concerns, if you've seen something, if your loved one has told you something, please go to our website and report that concern. We realize that we cannot be in every program every single day. And so you, as the news, and their friends, families, loved ones, staff, those being served by these programs, you are an important piece of this network of keeping people safe.
Were all of the February citations in the revocation decision connected to the three men's deaths, or did you guys find more problems after their deaths?
I'm going to turn you to Katie for those details. You're all right.
Reading the revocation license, the sanction document, it looks like this is a pattern going back to 2024. So why wasn't anything done sooner?
Great. Thank you for that question. So in the department, in the Division of Licensing and Background Checks, we hold a balance of two things. One, ensuring that individuals that are being served in our programs are healthy and safe. And two, ensuring that there are providers that can give these valuable services. So what happens, we would prefer always to be able to work and help a provider come in, not only come into compliance, but to be able to maintain that compliance ongoing and sustain that. And then when that can't happen, when we have tried other tools, then is when we move and we have to make that choice of, even if we're taking a provider out of the system, it is just irresponsible to help them, to have them keep operating.
I know the relocation decision specifically lists the Safe and Sound Day program. Does Safe and Sound also operate a residential program?
Safe and Sound does have other programs, and I cannot speak to those right now.
What happens with the patients that are under the care of Safe and Sound?
Right. So we, Department of Health and Human Services, work with them and their support system to ensure they are transitioned to a new and appropriate program.
One more question. What sorts of violations rise to the level of an investigation? Because in this document, it talks about not providing, or not providing background checks, adequate training, and then unfortunately we saw the culmination.
Yes. So we actually investigate when we find non-compliances. So, and again, the outcome of an investigation can be multiple things. If you have an interest in how we look at non-compliances and the actions we take, if you go to our website, there will be a place on there that you can look at our non-compliance policy.
And thank everyone for being here today. Shannon referenced a couple of things that she wanted people to direct their questions to me. So touch base with me before you leave if there is a question you didn't get answered. No, we're not taking any more questions at this time, but I'll connect with you individually. Okay?